Dear chairmen, dear colleagues, it is my pleasure to present my PhD project. My name is Máté Éliás and I'm a third-year resident doctor. My vision is that in the future, having a child above the age of 40 will be not a question of luck anymore, but the result of a good quality and safe treatment. Therefore, I want to work on novel treatments of infertility. At the moment, we have two ongoing projects, both of them in connection with the PRP treatment of the ovaries. Our first project is a meta-analysis to collect and evaluate the so far existing evidence of this field. Nowadays, the age of the first pregnancy, the maternal age of the first pregnancy is increased. Therefore, specialists who are working on the field of assisted reproduction have to face the increasing challenge to treat patients with diminished ovarian reserve. Infertility affects around 1 out of 7 couples worldwide. Diminished ovarian reserve is one of the most common reasons for that. IVF is the preferred treatment for these patients. As the graph shows, the fertility of a woman rapidly decreased over the year of 40. At the age of 45, having a child from an own oocyte, even with the help of assisted reproduction, for the chance of that is below 1%. For these patients with the worst prognosis, oocyte donation is the only option. But this is a very controversial option because not everybody can accept it for ethical and religious reasons. Enhancing the level of own oocyte could be a good alternative for this donation. PRP is a very promising new method which was successfully tried out in several fields of regenerative medicine. Both in case of human and animal studies, after the PRP treatment of the ovaries, AMH and FSH levels improved, and some patients from the worst prognosis group were even able to reach spontaneous pregnancies. Despite these promising results, PRP treatment of the ovaries is still not widely accepted in the clinical field. In our meta-analysis, we want to collect the main fertility parameters of the studies in connection with ovarian PRP treatment. We did a systematic search in these 5 databases with these search key, and we found 41 eligible articles. Our results are very promising. 17% of the treated women were able to reach biochemical pregnancy, which means roughly 1 out of 5 treated women became pregnant after the treatment. It is an outstanding result if you take consideration that these patients are from the worst prognosis group. Most of them had a history of infertility of decades and had several unsuccessful IVF treatments in their medical history. According to the existing protocols, most of them had the only chance, the oocyte donation. 10% of the treated women were able to reach successful live births after the treatment. This number could be even higher, but most of the included articles were published so early that most of their or some of their ongoing pregnancies were not able to succeed in live births. Our most interesting result is the relatively high number of spontaneous pregnancies. 77 patients, which means 6% of the treated women were able to reach a pregnancy after the PRP treatment without any further hormonal therapies, which is a very outstanding result if we consider the very bad prognosis of the patients. The other fertility parameters also improved. The level of AFC became higher, but it didn't reach the level of significance. But in case of IVF treatment, both the number of the collected oocytes and the number of embryos fertilized were significantly higher after the PRP treatment than before that. In case of the hormonal levels, 2 and 3 months after the PRP treatment, the level of FSH was significantly reduced, which means a better ovarian work than before it was. In case of the AMH, which is the most important marker of the ovarian reserve, in every 3 months, which was measured after the PRP treatment, the elevation of the AMH level was significant. In case of estradiol, the changes were favorable, so the level of estradiol became higher, but it didn't reach the level of significance. In case of mid-cycle estradiol, the elevation was significant. The level of LH changed parallelly with FSH, but the reduction didn't reach the level of significance. There are some limitations of our work. First of all, the available literature is poor. Only observational studies are available so far. No RCTs were published in this question. Another limitation is that more than half of our women who were included in our study came from 2 articles from the same author. And lastly, there's a big methodological heterogeneity in the PRP preparation and application and in the protocol of the IVF treatment which the centers used. Our conclusion is that PRP treatment of the ovaries improves pregnancy rate and other fertility parameters in case of women with diminished ovarian reserve. But in my opinion, further RCTs, well-designed RCTs with bigger patients number needed to gain more robust scientific evidence for this. At the moment, we are working on the manuscript. In the next month, we hope that we can submit it. Our second project is an RCT from the same field. Our aim is to find out which is the ideal time frame between the PRP treatment of the ovaries and the IVF treatment after that. We want to use the same pie code just like in the meta-analysis. Here I listed the planned inclusion and exclusion criteria. In this study, the treated group will get PRP treatment and an IVF after that, and the other group will get only the IVF, and this is how we can find out the difference between them. We want to collect the same outcomes like in the meta-analysis. PRP treatment is a new, very promising method which can help to improve the quality of life lots of infertile couples. And it's important to highlight that it can not only support IVF, but it can help those patients who to get spontaneous pregnancy who reject the idea of IVF for some reason. And thank you for your attention.
Thank you. I have a question regarding your first project. Why is that the risk of bias assessment, the overall risk were so high, almost in every outcome?
Okay, I see. Yeah, the risk of bias was high in case most of the outcomes. The reason is that because the design of the studies, I think, was not careful enough. They didn't take consideration, for example, the factor of the male factor. So they simply didn't check the as an inclusion or exclusion criteria the the quality of sperm of the previous father. So I think it's a very important question in case of the number of embryos, not simply the it's not the question simply of the oocyte of the woman, but it's also the sperm of the man is also very important in this question, and they just didn't consider it. So that's why, for example, we give high risk of bias.
Thanks for the great presentation. Obviously, I'm not an expert in this field, but what you show seems almost too good to be true. So raising the chances from basically 0 to some meaningful chance of pregnancy. So based on your experience, would you recommend to start using this right now? Because as far as I know, it's not available, right?
Yes, I think I would recommend it. The treatment itself is pretty safe. So you can make it with the same needle in the same surgery room, just like the collection of the oocytes, which you already have to do if you make an IVF treatment. So it doesn't have any more additional dangers. And if these numbers are too good, then if the success rate is only half of this, then it could be also a very big support. So, and the method is also very cheap. So you just have to collect some blood from the woman, make this centrifugation, and you can give it back. So it's relatively cheap. If you think how much you have to spend on oocyte donation, it's more, way more cheaper.
Congratulations for the very interesting study.
Thank you.
Is there any idea in the literature how this beneficial effect develops? Like, what is the mechanism through which this simple method can work?
It's there is an answer which is I don't know 7 pages long, and it's from the physiology book from our medical studies. But in a nutshell, I can tell that these platelets contains growing factors in their granules, and this is the thing that can improve the blood amount in the ovaries. The circulation will be better there, and even somehow these growing factors can change the physiology of the oocytes itself.
Thank you.
Thank you.